If you can't sleep at night because you are suffering from hip pain, maybe the pain's on the outside, which is very common in bursitis or tendonitis, or maybe you suffer from osteoarthritis where the pain might be on the inside of the hip in here. In this video, I'm going to give you a couple tips before we go to bed to help with that nagging hip pain and give you 3 positions that's going to help you sleep tonight. Let's get to it. Oftentimes, people with hip pain will find the nights difficult. The reason being is we're not moving, we're compressing the joint with how we're sleeping, and there's no muscle activity. So it allows inflammation to set in, and that is when it starts to hurt. It nags and prevents you from sleeping. What you need to do is assume the right position to help decompress the hip so you can get your sleep. The first thing I'm going to do is show you the simplest way on your back. This is a very common way to sleep, and it's probably one of the most effective, but I'm going to show you one subtle tip that's going to maybe make the biggest difference in terms of how you're sleeping on your back. Oftentimes we're told that on our back is good because it decompresses the hip, it takes us out of gravity, it's good for the lower back and neck. What I'm going to show you here is something that's going to help decompress the hip a little bit more. So on our back, we often want to sleep with a thinner pillow so that it's not forcing your head forward, and with a pillow underneath our knees to help support our lower back. Now, if your hip is bugging you, one of the things we can do to help alleviate that's very subtle, that might make the biggest difference for you and ensure you get a good night's sleep, is take the affected side. So let's assume your hip pain is either here or here. We're gonna be on our back with a pillow underneath our knees, and we're gonna take the affected leg and we're gonna cross that leg over the other side on the ankle. What that's going to do, it's going to put our leg in slight external rotation. Sometimes you're going to find that that takes the pressure off the area that's bugging you. And I know it's a subtle difference, but give that a shot. I'm sure that's going to make a difference. The other thing, a smaller percentage of people might find the opposite helps. Take the unaffected leg and cross that over. This actually helps pull the legs in slight internal rotation, which for certain people with certain conditions, that might be more effective. But oftentimes I find the affected leg on the outside with slight external rotation and a little bit of a support underneath the knees is the best way to sleep with hip pain. Now, I am going to show you another 2 ways. One where our affected side is up, but I know there's those people out there that say, I have to sleep on my one side because the only way I can sleep, but that just happens to be the side that hurts. Well, stay tuned because I'm going to show you how to sleep on the affected side down. But right now, let's go the affected side up. So very simply with this one you can use a couple pillows here. One of the things we're going to do is obviously we're going to keep the pillow between our knees. One thing we can do though is to change the angle of this leg here, there are a couple different options. One, we can take a pillow and put it lengthwise and have a pillow here. This allows our leg to come forward. Sometimes when we bend our knee to more of a 90 degrees with the affected side up, it helps support the hip just enough to allow you to sleep with this affected side up. You need to play around though a little bit here, because what you want to do is make sure this actually pillow is too thin for me when I'm on my side, so we do need a thicker one if we're on our side, just as in the side. For some of you though, you might want to keep your leg straight in terms of as close as we can get it as possible. This is where you'd put a pillow, an additional pillow between your ankles. Again, just to help from that rotation of the hips. Sometimes when you're on your side, it's a bit too much pressure, so if you put 2 pillows with one at your ankles, it just really helps keep your pelvis and hips balanced so that when you are sleeping on your side with the affected side up, it'll help take the pressure off this area and allow for you to get comfortable. You're going to notice that it is finicky. It's very subtle. Some people will be more comfortable like this. Some people will be more comfortable like this. So you got to try and find the right position for you where you're putting as little of the pressure through this part of the hip and through the outside of the hip as well. Now, I know some of you that have a hip problem, say on your right side, you have to sleep on your right side. I'm going to show you how to do that next. So just to summarize, I've shown you a very subtle tip on your back, which is probably the best position for most people. We've also gone through where your hip pain is on your right side and our right side is up or our unaffected side is down. 2 variations depending on your hip angle that will give you the best relief. That you're gonna have to experiment with that a little bit to know which side works or which angle works best for you. Now let's go to the other side. Let's say that your hip pain is on the left side and you just love sleeping on your left side because you've done that your whole life and you've trained yourself to do that. Well, there is a way that you can still sleep with hip pain with that side down, and I want to show you that right now. Now, This one you're going to need a few pillows for. I like a smaller pillow for here, but you can use whatever pillow you have. They will all work. What we're trying to do is decompress the side of the hip. So we're going to put a pillow on our rib cage, or under our rib cage, as I should say, and that's going to just help pull some pressure off this point. Again, a pillow that's big enough to keep your head angled under your rib cage. This is the affected side down. Two ways to do this. We can do it also with a pillow between our knees, and for some people that'll be enough decompression or released pressure on this affected side down. Right now, based on this pillow, this is obviously a floor, so with a mattress you will sink in a little bit, so you might have to play around with the size of the pillow, but already I can feel less pressure on this hip. If you still feel pressure on the hip because maybe you have a very mattress that sinks in or it's not supportive, then you take this pillow and we put it on the knee here, so that you're taking some pressure from here and almost letting this hip float a little bit less compressed on that one side. Now for me, if this was me, I don't find this comfortable without a pillow here. So if you have a long enough pillow, you take the pillow and you just wrap it like this. For me, if I'm sleeping with hip pain on my left side, this is the most comfortable position. As I say, a pillow under your rib cage, under your thigh here, just lifts you up a little bit to keep the pressure off the hip. Now, I want you to try all three of these tonight and tell me which one works best for you. And I know if you experiment a little bit and self-correct when you wake up, then you're going to find the right position. Now, I know that it's tough to stay in a position. The key, though, for most people with hip pain is not being able to fall asleep. Once you fall asleep, hopefully you're able to stay asleep. And if you are waking up with pain still, then just self-correct and make sure you're putting yourself in a position to get you enough comfort to fall asleep again. Now, I want to show you two more things to really help with you being able to fall asleep when you're suffering from hip pain right before you get in the right position to support a healthy night's sleep and less hip pain. As promised, two tips that when you first get into bed before you assume the position, I want you to try. Often the simplest things are things that work the best, but we for some reason get away from it. One of the best things you can do before you go to bed is ice the area. We want to do this in a couple different ways. If you have pain on the outside, it's very simple to lie down with the ice pack directly over some clothing so it doesn't give you frostbite on the skin. Keep the ice pack on your affected side for 10 to 15 minutes on, take it off for 10 to 15, and put it back on for 10 to 15. So this would be a good time to calm down before you go to bed, read a book or something while you're doing this. If you have it on the inside of the hip, the same thing, just put it there for 10 to 15 minutes with 2 intervals. That's the first thing when you first get into bed. It's going to help reduce inflammation and reduce your pain. The next thing you want to do is just do some gentle stretching. So let's hypothetically say, again, the hip pain is on the right internal hip or the lateral hip or the outside of the hip. Very simply, resting, relaxing, we're going to take the affected side up and just bring this over like a figure 4 stretch. It's going to help open the hip here, stretch out the piriformis muscle, the TFL, all the muscles that can be affecting and causing your pain. You're going to hold this for about 30 seconds. If this is easy, then you can take this leg and pull it to your chest if you need to, just to get a little more stretch. Finally, we can start to rotate one way and then the other way. Be careful when you go into the affected side. I don't want you to roll over onto it to cause some discomfort, but just hold this position, like I said, for about 30 seconds, and you can rotate through. Like for me, this feels really, really good. It stretches the whole area gently, and even to the lower back, again, just to help relax things before you get into the position that's going to work for you, either your back with your leg crossed on your side with the affected side up, or the decompression on the affected side down with a pillow underneath your ribs and your thigh. I appreciate you tuning in. I really hope that one of these positions, in addition to these last final 2 tips, give you some relief so you can get some sleep tonight. Let me know in the comments which one you like the best. If you're new to my channel, maybe you consider subscribing so you can be informed when I upload a new video. And as always, I appreciate you tuning in, and I can't wait to see you in my next video. Until then, stay well.